Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm super excited to have a wonderful guest today, Dr. Qiratulanne, also known as Annie Khan. I'm going to have her tell us a little bit about herself.
Hi, everybody. Kita, thanks for having me on your podcast. I'm really excited. A little bit about myself. I am a board-certified family physician. I did my residency at Boston Medical Center, and I did a 2-year fellowship through the HEAL Initiative at UCSF in global health, and completed a master's in public health through UC Berkeley as of most recent. Currently, I am in the San Francisco Bay Area. I work for John Muir, which is a nonprofit hospital, and I work in the urgent care doing respiratory clinic and standard clinic. So I've been seeing a lot of COVID cases as of recent. And I also am a physician through Crossover Health on the Facebook campus.
Wow, you're doing such a lot of amazing things. Let's bring it all the way back to the beginning, and you can tell us a little bit about what made you choose family medicine.
Well, there are no physicians in my family, so I didn't really have many options to choose from, but I knew coming from, a first generation South Asian background, my parents are both born and raised in Pakistan, that we didn't have very many options. As many probably know, our options were doctor, lawyer, engineer. I wasn't the best at debate, and I wasn't the most clever or conniving, so I didn't pursue law. And math was more of a struggle and a class that I just had to take so I could move on and take all the classes that I wanted to. And fortunately, I had a gift in the sciences, and chemistry was one of my strengths. And so in high school, I felt that was something that I can pursue a career in, something in the sciences. On top of that, I was always an extrovert, and I really enjoyed being around people. And so taking that and science, I think that is a pretty good example of what family medicine is. Also, I was fortunate enough to travel abroad when I was younger to kind of connect with my own community and my culture. And when you see places that are vastly different than the United States, especially if they're low resources, low income, you have a better understanding of how healthcare works and how crucial it is abroad. So I think those were pretty much the foundations of what allowed me to pursue family medicine.
That's awesome, because as you told us and showcased through your plethora of different positions that you currently hold, family medicine is so diverse, and there are so many different ways that you can impact communities. And when you merge science and your love of people, it's kind of a no-brainer, because you do see so many different things, and you can take care of people from the cradle to the grave, and you can kind of reinvent yourself as you go. And also, you mentioned that you have done some work internationally, and the things that you learn in family medicine can definitely be an asset when you're doing missionary work or other things. Can you tell us a little bit about the experience that you do when you go internationally to give back?
Yeah, so because of my experiences when I was younger, after college, I had an opportunity to work on the border of Afghanistan and Pakistan through auspices of the World Health Organization. I have family in Pakistan who have higher positions out there. So I was just very blessed and fortunate to have outlets that gave me opportunities to pursue a lot of volunteer work. I was always that kid that I was like, I want to be in the village. I want to be one with the people. I want to really understand humanity at its foundation and in its roots. because I feel like that's the best way to learn. The best learning experiences that I've had have been through experience and, acknowledging that despite all the privileges that I grew up with, it was really important for me to understand medicine from the perspective of those who didn't have the same opportunities than I did. I think that enables you to be a better physician. And my ideology has always been treat each individual the same, despite what background they come from, despite what their socioeconomic status is. And because the beauty of medicine is that it doesn't change. It's the same for each individual person. And that's one of the reasons why I loved global health so much, is because I really got to understand medicine for its true nature. There was no fluff that you get when you pursue medicine here in the States with insurances, with big organizations, with big pharma. There's a lot of politics that are involved with that. But with global health, you really get to understand humanity and medicine on a level that kind of helps you grow, not only as a human being, but as a provider as well. So my roots in pursuing global health and family medicine really began when I was volunteering in rural villages and doing a lot of education, not so much medicine, but more education for reproductive health and women's health in rural South Asia, specifically Pakistan and Afghanistan. So from there, I went to med school, I went to residency, and then I pursued global health again during fellowship, where as a Pakistani person, I never thought I would have an opportunity to go to India. I don't know if many people are aware, but there has always been a little rivalry between the two nations and two countries. So I was fortunate enough to have an opportunity to go to rural India, which also was a really enlightening, great education that taught me that people are just people and we all have the same diseases. And and if you can treat people in one specific area and see what those needs are, you can take that and apply it to other parts of the world that are very similar, despite having any geopolitical differences. So from there, I worked for a rural NGO, which is a non-governmental organization, through my fellowship, where I had an opportunity to train 5 family medicine residents in India. And, family medicine in India is vastly different than family medicine in the States. Out there, when you're a rural doctor, you're essentially doing everything. And in the States, we also have that perception of family medicine, but out there, the family doctors were doing full-on surgical procedures and admitting these patients into the ICU and doing C-sections and delivering babies. And it was just full spectrum medicine. So that also gave me perspective as well, that, family medicine is so broad and in the States, we can kind of cater it to what our specific interests are. But in places where you don't have resources, where you don't have a lot of manpower, you really have to kind of tap into all this knowledge, a little bit of knowledge that you gain throughout medical school, throughout residency, and make it applicable to all of humanity. Like, I never thought that I would be starting chemo on patients who have non-Hodgkin's disease and cancer, various different types of cancers, but in training residents to do that. So, you kind of have to deal with an imposter syndrome. And on top of that, you have to learn how to kind of navigate what you're most comfortable with. And again, continuously learn medicine, and then be able to come back to the States and kind of like utilize whatever you learned abroad and make it applicable out here. I don't know if that makes sense, but
it makes complete sense. And I think that you really brought it home, where you have this love for giving back and reaching out to people, and people are people. So it's universal, and healthcare is universal, not in the way that we would like it to be in America, but just in the theme of universal healthcare. And there there are problems that everyone has, but they don't have as many resources as we may have. So you really just bring it back to the basics of your love of science and your love of people, and you marry that together and learn how to work with limited resources in order to impact communities and help them thrive and help people live their lives in the way that they were intended to be. So I love that. And then also for you to be able to go and teach others to do it, that is the gift that keeps on giving.
Right. And I just want to add that, even though there is global health, and essentially when people think about global health, we think of outside of the US, but there are communities that are just like places in rural India and rural Pakistan, and rural Africa here in the United States. And one big example of that is Navajo Nation. And I just want to mention that because I don't think Navajo Nation gets the attention that it deserves. Where I used to work through my fellowship, Shiprock, statistically 70% of young people had chlamydia. And, these are places here in the United States, most of the population has type 2 diabetes that's completely untreated, where basically we would talk about, kidney health and, the probability of losing your foot or your toes. It was just so high, and it almost became normal to this group of people. And so I just want to mention that, we still have a lot of issues here in the US that also need to be addressed.
I appreciate you mentioning that because I don't think that it does get enough credit. Recently, I was reading somewhere that in our healthcare system, 9% of our physicians, total doctors, take care of 20% of Americans. That's 20% of our nation, only covered by 9% of physicians. And right now we're seeing that run rampantly with the COVID pandemic and how there's decreased access to care. And even in the disparities among telemedicine visits, like it's okay in urban centers and things like that where people are resource rich. But if you don't have the internet, or if you don't have a phone or running water and the basics and things like that, there's a larger divide, even with the digital divide.
And I mean, even outside of Navajo Nation, we have communities all throughout the US that I feel don't get addressed. And, the providers that are there that are available are primary care physicians. And, we also have lesser people going into primary care, primarily because of finances. But, just for, young people that are pursuing medicine, you're going to be okay. You will make money in primary care. And there are a ton of opportunities. I don't think this is really taught in medical schools or in undergrad. I think people, when they think of medicine, they think there's a ton of money involved. That's not the case at all. You really have to work, and you have to find opportunities that are going to be best catered to your abilities and to your passions. So don't pursue something for just the money, because ultimately, even if you specialize and subspecialize, you're going to be losing so much vital knowledge that you gain throughout your training. Like we're only human. We're not going to learn and know everything forever. Not that I'm saying don't become a specialist.
We need them all, but I think what you're saying is don't let finances dictate what your passion is and what you want to pursue, because there are ways to balance that and to find ways. So like if you want to go and work in an Indigenous community, there are programs like the National Health Service Corps and other government run things that can reimburse you for loan repayment. And there are other scholarships and a lot of other things out there. So don't let finances dictate your dreams.
Exactly.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of PreMeds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. It's a complicated process, and even students with great grades and MCAT scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
I loved one other thing before we move on that you mentioned about your global health work and working in rural communities. You mentioned that sometimes one can let imposter syndrome kind of dim like what they want to do or what you can believe that you're doing. Can you speak a little bit about if you've ever experienced imposter syndrome and how do you combat that?
You know, I think medicine is one of those fields where imposter syndrome runs rampant, because no matter how much training you have being a physician or pursuing anything in medicine, the expectation is that you were supposed to know it. And if you have trained that you're going to do this, you're going to follow the guidelines to a T. But the problem is there are differences, and medicine is still an art. Mm-hmm. And so you kind of have to utilize whatever tools that you were given in residency and take whatever knowledge that you've retained and, you know, apply it with the art that you're learning. So when you're a new physician or someone who just finished residency and is starting fellowship, you're still green. And now you've just developed a new layer of how to be professional and how to provide for others. My biggest example of imposter syndrome is when I was in the villages and we had a lot of patients who were multi-drug resistant TB patients. We had kids that were 10, 11, 12, 14 years old who would be at the end stage of their TB and still require intubation. And at that point in time, you know, you still have this ideology that, and I don't want to call it a savior complex, but to some degree it is a savior complex where you feel like you have this duty to save as many lives as possible. But also, I think at that moment, you start to learn about yourself and you also start to understand palliative care. And I think the problem with imposter syndrome and being so young in your career is kind of struggling between being that savior and saving children's lives, or, you know, someone who's older who might not be a candidate for having their life saved versus palliation. And I think my example of that was, you know, I really had to triage and determine who got to live and who had to die. And you kind of have to take, you have to take that role of confidence and make such difficult decisions with calmness and with confidence. And I think that can, you know, ultimately take a little bit of a toll on a young provider, you know.
Absolutely.
I don't know if that's a good example,
that is
you
a perfect
to empathy, or not pretend to have empathy, but kind of have empathy, but make crucial decisions, you know, in 5 seconds, you know, without feeling defeated, without feeling that you're making a bad decision. And I think it's especially harder if you're a woman and a person of color. And I mean, in my situation, I was not only a woman, I was of Pakistani descent. And even though I'm American, and you come in with this like American arrogance to some degree without really acknowledging it or knowing it, but it's something that we do carry when we go abroad, whether we acknowledge it or not. I think it humbles you in many ways.
I appreciate you for bringing that up, because honestly, I think that this is the first time any physician who's been on the show with me has ever mentioned palliative care. And as physicians who are new in your career, who may not have started rotations, who may have not entered medical school, I think it's something really important to bring up, because we talk about life a lot. And a lot of that is important because that is the purpose that we are here, in theory, to help people live the lives that they are given. But everyone has an end. And as physicians in training, that becomes quite evident as you learn to be with people in their most intimate moments, the last moments of their life.
Yeah.
And it's something that no one should take lightly.
Mm-hmm.
And it's a big responsibility that we all carry. And we may not necessarily practice in high stakes environments all the time, when everyone may not be an emergency room physician, everyone may not be an ICU doctor, everyone may not practice in a resource poor environment where they have to make such decisions as Dr. Khan had to make. But you'll all come in contact with it, whether or not it's in medical training or in residency or in life. And we're going to have those, you will too, the unique perspective of transitioning. So I think that is something that you shouldn't take lightly, and you should continue to practice empathy around. Each loss of life or transition is important and different and unique. And I really think that that's something we may talk about on a future episode with, because you don't want it to get to a point where it's just another death or another life or another number. So I think that it's very important that you brought up that struggle and the types of decision making you will have to make as a physician leader, and the support that you will give to the patient in their last moments, or their family members who may be near around them, or your team members where you'll have to regroup after a loss. So there's a lot of reflection that will come along with that as you go along in your journeys.
Yeah, I completely agree. And you don't really, this is not stuff that you're going to learn in medical school. This is all life experience, and you learn as you continue to pursue your job as a trained physician or in training. But you really, I think it really hits home after you're done with training, and you have a lot more autonomy in making those decisions for yourself.
Yes. And we definitely took a left turn. I will tell our listeners that typically I prepare a few questions for our guests, and that one wasn't on there. So now we're going to move to a different facet of Dr. Khan's life and talk about one of her other jobs. She is literally a Facebook doctor, and not just someone who's just very popular on social media. Like, she actually works at Facebook. And I think that that is so cool. So I just wanted her to share a little bit about what a day in the life as a Facebook physician looks like.
Yeah, so I mean, it's very different from my global health experience. I will mention that. I don't know if I'm allowed to talk. I'm not going to talk specifically about patients, but I generally have a pretty healthy population between the ages of 20 on average to like 45. I have like a very handful of patients that are in their 50s. Don't have anyone in their 60s. So it's very different because I used to work a lot with children. I worked with a lot of elderly. I had a job experience doing geriatrics for a year before I went ahead and pursued this job and this opportunity that was basically my friend connected me with this job. And one of the reasons is because of physician burnout. When you have so many intense, experiences in family medicine, which is really common when you're working with a lot of Medi-Cal, uninsured, low resource, low income populations, in order to do a really good job, it takes a huge toll, not only on the psyche, but just on your ability to be a good doctor. And so I kind of wanted to switch it up so that I can actually pursue a job where when I provided patient education, there was more likely to have compliance. Mm-hmm. I think this was the first time where my patients, definitely follow the education and are pretty much 100% compliant. and I've never had that experience. And the beauty of this job is that you really learn a different skill in getting a good history and coming up with a good plan and having reciprocation from your patients, which is really nice. And I hate to say it's difficult in its own way, because you have patients that are very intelligent who also read all the guidelines and will read all the articles that are in JAMA recreationally, not because, they are also physicians. They have family members who are also physicians, and they're very well versed. So, you really have to be on top of your game and really know your medicine.
I can totally identify with that, as I practice telemedicine right now, and it's a different patient population that kind of self-selects. So in your instance, working at a specific organization where you're kind of like employee health and built in and that kind of stuff, like, yes, those are your workers. They're young people. They're on top of things. They're health literate. So you're going to have different things coming at you, as opposed to someone who in a rural area may not know how to read or may have not passed the 3rd grade. So you're dealing with triaging in a different way, because in telemedicine, patients kind of self-selected. They have mobile devices and they're able to text and they're able to call and do videos or Skypes and things like that. And they have all these questions because they Googled it before they found your app. So it's a different kind of mental exercise when you're communicating with these kinds of patients. And I think that it's also fun, and it keeps you on your toes, and it keeps you reading evidence, because you need to know a lot more than what your patients know. So I think that that's super exciting, and it does show the diversity of family medicine, where one month you could be in the middle of Utah seeing a specific group, and then the next month you're in Silicon Valley. So it's just very interesting to me. And another question, just in terms of your background, you mentioned that you're into sexual health and wellness. And I find, like, as we talked about, family medicine allows us to see all kinds of patients. And lots of physicians love to talk about women's health, but men's health seems to be kind of a forgotten group. Can you tell us how you address men's reproductive health, and how students should think about approaching it from a primary care perspective? And that may be a big question, so just kind of like a general sense.
Yeah, no, I would love to answer that question. So my own specialty is women's health, and I love family planning, but I feel most recently, both in my urgent care setting and in my primary care setting, I've gotten more male patients, and they're young guys. And what I've realized is that with working in high stress fields, anxiety and depression are eminent. And what I've noticed is culturally, men don't really have experience in kind of processing these feelings, starting any medications, or even discussing or talking about that, because traditionally men kind of just hold everything inside and are taught from a young age to just get over it. Boys don't cry, they just move on. But ultimately, this affects physiology too. I've noticed that I've had a lot of men just requesting, Cialis and Viagra and have intimacy issues with their partners. But what is the root cause? Is it burnout? Is it overwork? Is it stress? Is it anxiety? Is it depression? It's all of those things. I just find it very, being a provider and knowing that there are a lot of other deeply rooted issues that need to be addressed in these particular cases. But, a lot of my male patients just want an easy fix, easy fix to have their fix. But, it doesn't work like that. And I mean, for good long-term outcomes, as we've had in many studies and across the board, you have to deal with what's going on inside in order to fix a long-term problem. For example, like erectile dysfunction. You should not be a 33-year-old male who, has a great job super healthy, no chronic disease, eating well, exercising, having any issues with erectile dysfunction other than performance anxiety, possibly due to, either having a lot of pressure that you're a 33-year-old male who probably has it all together and your partner is expecting everything from you. But, that's unrealistic. And I think these issues need to be addressed early on. It's difficult to address during physical examinations because I think in general, what I've noticed is a lot of young, healthy male patients don't even want to talk about this stuff until they have that one night where they're having some trouble performing and for their partner, and it becomes a huge concern. So my goal ultimately is to be able to kind of educate and help, my male patients or, male patients in general to kind of start to address these issues and be comfortable with it. The beauty of the millennial generation is that they've made therapy so normalized and it's become such an important part of one's self-care that I kind of want to continue to pursue that outlook for a lot of people because anxiety, depression is psychosomatic and affects the human body in so many ways. And, for young, healthy people, these are a lot of the reasons why people can have a lot of problems, including headaches, migraines, erectile dysfunction, as we mentioned, heart palpitations, hair loss. There's so many physiological things and processes that occur just from anxiety and stress and depression. So I feel like, in the experiences that I've had with my particular patient population, anxiety, depression is pretty much the root cause of a lot of these issues, especially with men's health.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
Absolutely. I think that a lot of times people have this physical ailment and they want a quick fix with a pill. And we don't realize that a lot of our things are tied to lifestyle and stress. So when we address that, a lot of the things come into place. But it takes someone that listens as a physician to also think through these things and not give them the pill or the easy fix to send away.
Also, there's side effects. People forget about side effects. And, you don't want to be responsible for giving someone who's completely healthy a medication that can cause these potential side effects.
Absolutely.
And I think people like to overlook side effects when they look at the benefit more favorably. I think that's another piece why it's so important to educate patients, continuously and not just, throw meds.
Absolutely. You have shared so many different pearls of wisdom and facets of information from all of your experiences through your journey through medicine. I want to leave this with our final question for our listeners out there, for you to leave a piece of advice for those who are just starting their medical journey, both pre-meds and medical school students. What would you tell them?
So if you're pre-med, just know that getting good grades is really important, but don't beat yourself up. There are so many opportunities to go to medical school. You know, there's post-bac programs, you can always do a master's program, and it's okay to get life experience right after college and then go to medical school a little late. I was 28 years old when I started medical school, so I'm so happy because I had all those international experiences that really allowed me to grow up as a person and be able to go into medical school, being 100% about why I wanted to be a doctor, and allowed me to continue to pursue a passion in family medicine and community health. So, you know, it's funny. I don't know about you, Kita, but there's always gunners who are super cutthroat because they're pre-med. You know, don't be that person. You know, don't be that person. Just do your best. Yeah. Do your best, make good friends, find good study groups, and get help. Never be ashamed to ask for help. I'm not a genius at all, but I am a hard worker, and hard work goes a long way, and people can see that. Be genuine about your pursuit of medicine. Don't do it for the money. Don't do it because your mom and dad really want you to be a doctor, because medicine is hard. And it's hard in the sense that it really will have an impact on your psyche. And you really have to be a resilient, strong person to be able to continue a lifetime of providing medicine and medical care to people. So I really like to stress that, because you always see little kids that are like, I'm going to be a doctor when I grow up. And I'm like, oh, you don't know what you're getting into. And really hone in on your passions. You know, if you really love one thing, you know, pursue that, because you'll be successful and do well in a field that you love and that you're super passionate about. And, you know, if I ever have a kid, of course I'm going to tell them to pursue medicine, because that's what I know and that's what I love. And I hope that I have a child who will love science and medicine like I do. But at the same time, if I feel like it's hurting them, it's not making them happy, and they're not good at it, I'm not going to torment this child, you know, because we want good doctors with good hearts out there. Medicine's already a tough field as it is.
I love all of those pieces of advice, Annie. I could not add anything else, so I'll just summarize. I think the most important thing you said is don't be a gunner. There's space for everyone. If you've made it to medical school, you deserve to be there. So be pleasant, learn from one another. Everyone will have their own strengths. You may be great at cardiology. Somebody may be better at pulmonology. Help each other. Don't compete. There's space for you.
Right. The goal is to help people.
Yes. The second thing that you said was, if don't do I think I summarize it as, when I'm mentoring students, is there's anything else. And this sounds weird because I'm hosting this podcast encouraging you to go to medicine. But if there's anything else that you would prefer to do besides medicine, try that first. And if you still have the urge, go and do it 150%. But medicine is really hard, and you have to really want it. And there are billions of ways to help patients in different ways. So you can be a healthcare administrator, you can be a social worker, you can be a nurse, you can be 1,000 different things and help people. So you have to want to do medicine to do it and do it well. So I think that I couldn't have said anything better. I think you've given us so many different pearls of wisdom, and hopefully we can have you back soon and you can talk about more things if you're interested in that. But I will give you an opportunity to tell everyone goodbye.
It was so nice to chat and like talk about, you know, my experiences. You know, if anyone ever has any questions or concerns, you know, you guys can always reach out, and I'll be happy to help and answer any questions that anybody has.
How can they get in contact with you?
You guys can reach me at my personal email, QRAKHAN@gmail.com.
Perfect. Thank you for that. And we'll be sure to see if we can put that in the episode notes. And for all of you guys listening out there, please click the subscribe button, and I'll see you again next week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.